Hello, doctor. It's been so hot lately. How have you been?
Hi. Yes, I've made it through another busy summer season. How about you?
Honestly, I've been feeling a little down lately, so I decided to buy myself an iPad.
You've been feeling down? You're always so cheerful. I had no idea you were feeling that way.
Ah, you're definitely an F.
An F?
You may be wondering why we suddenly brought up MBTI. On our registration form, we actually ask patients for their MBTI, and many people wonder why we ask. So, doctor, what exactly is MBTI, and why is our eye clinic so interested in it?
Well, I suppose I'm partly responsible for that. But first, let me briefly explain what MBTI is. MBTI generally categorizes people into 16 different personality types. Depending on whether you feel more comfortable directing your energy inward or outward, you're categorized as introverted, I, or extroverted, E. When it comes to how you take in information, there's S for sensing and N for intuition. Then, based on how you make decisions using that information, there's T for thinking and F for feeling. And depending on how those preferences translate into your lifestyle, you're categorized as J for judging or P for perceiving.
I've noticed that since COVID, some people seem to get different MBTI results over time. Did you know that?
Of course, your MBTI results can actually vary somewhat depending on your environment and even how you want to see yourself.
Which parts of your MBTI do you think can change depending on the situation?
I think some traits can shift quite easily with a conscious change in behavior. I'm a good example myself. I'm a classic ENFP, especially a strong P. I'm very spontaneous and like flexibility, but that also means I'm not always the best planner. But there's one situation where I become incredibly organized and plan everything down to the smallest detail. Can you guess when?
When you're performing surgery?
Exactly. Especially during surgery, I become a meticulous, organized J. So rather than taking MBTI results too literally, I think they're best used as a reference to better understand yourself and others.
At our clinic, we've been asking about patients' MBTI before smile surgery. Is there a particular reason for that?
In my opinion, one of the most important factors in smile surgery is good cooperation from the patient. Procedures like LASIK and LASIK have shorter laser treatment times than SMILE, with fewer variables related to patient movement or cooperation. During SMILE, however, if a patient suddenly squeezes their eyes shut or moves their head while the laser is being applied, the suction can be lost. If that happens, we may not be able to continue with SMILE and may need to change the surgical plan to LASIK. That's why preventing these situations is so important. Patient cooperation is also important when we separate and remove the corneal lenticule created by the laser. There's usually little to no pain, but there can be some discomfort. That's why I think it's important to explain each step calmly, in a way that suits each patient's personality and individual tendencies. To minimize these variables, we ask about MBTI from the registration stage and spend time talking with patients during consultation to better understand their personality and how they may respond during surgery. People often say a surgeon's experience and skill are especially important in smile surgery. But I believe another key to a successful smile procedure is understanding the patient's emotional state and likely level of cooperation in advance, so potential variables can be prevented before they arise. I was also wondering whether MBTI might have something to do with how patients choose which type of vision correction surgery they prefer. What do you think?
Patients with an E preference often ask about getting back to sports, leisure activities, or upcoming travel plans after surgery. So they tend to show more interest in SMILE because of its faster recovery. On the other hand, patients with an I preference often focus less on what they can do immediately after surgery and ask more about which procedure would be the safest choice for their eyes. So personality may influence surgical preferences to some extent. Recently, we added something new to our surgical chart besides MBTI. We now ask patients to write down their favorite artist and what music they'd like to hear during surgery. How did that idea come about?
It actually started with a patient who was about to undergo smile surgery. He asked me, "Doctor, could you play the second movement of Beethoven's Symphony No. 4 during my surgery?" I remember thinking, Symphony No. 4th? Have I even heard that one? But when I listened to it during his surgery, I realized how calming and reassuring it could be for a patient.
Today, we talked about why we ask about MBTI and music preferences on our patient charts. We hope this answered some of your questions about our clinic.
Bye.